The Mental Health Crisis Alliance started about 10 years ago looking at the issue of people in a mental health crisis getting to emergency rooms and having to wait for a really long time, up to 24 hours, and often being transported out of the metro area for their care. And this group came together and really focused on adding additional community services. As the Mental Health Crisis Alliance evolved, it became clear that they wanted to transform the system of care by adding an urgent care for adult mental health. We offer crisis assessment, which is that very first face-to-face when you're in a mental health crisis with someone who can help you decide what to do next. We offer crisis stabilization services, which can be a little bit longer term, a month or so of care to make sure you get back on your feet. And we offer rapid access and gap psychiatric appointments to get people into needed psychiatry much quicker than they would otherwise be able to.
Our intention is not to supplant or replace the services that you already have in place with the client. Our wish is to work with you together to get the best possible service for the client, the right service at the right time.
So last week I saw a woman in the emergency department that was feeling depressed, anxious, needed to talk. She was not acutely suicidal. She waited a long time, got more anxious while she was waiting here. I referred her to urgent care for the next episode that might be similar to that, and I got a call yesterday that she did go and was very pleased with the results there.
We involve consumers in all of our decision making, and really what the urgent care offers is when you walk in, you'll see somebody right away. There's no long wait. It's a recovery-focused, welcoming environment, and you'll be able to get the care you need right then from people who know mental health, and that's their specialty.
And I think what really makes us unique are the peer support specialists that we have providing services here. Peers offer hope for folks in a way that professionals just can't by their very presence. And the peers have also changed the way we deliver services here. Their very presence here has created an environment that's just really conducive to folks getting help and hope.
And what is it that you're needing from us today?
As someone that's had mental health challenges and has been in crisis, this is just such a wonderful, new and innovative place to be able to work and to be able to support the people that are coming in. It's wonderful.
We are working with all of these great partners to change the system, and it isn't coming from federal health care reform, it's not coming from mandates, it's coming from people who genuinely would like to improve care for people with mental illness, and that it feels great.
People living with mental illness are not their diagnosis. They are not bipolar or schizophrenic. They have bipolar illness or schizophrenia or depression, just like people with cancer are not cancer. They have cancer, and it's so important that people know that they can and do recover from their mental health challenges.
Urgent Care for Adult Mental Health is located at 402 University Avenue East in St. Paul, just north of downtown St. Paul and east of Interstate 35E. Walk-in visitors are welcome, no appointment necessary. Phone support is available 24/7. Services for adults ages 18 and older include crisis assessment, crisis stabilization, rapid access and gap psychiatry, peer support, 24/7 phone support, referral to community resources, and follow-up services to further aid recovery. Ramsey, Dakota, and Washington counties have mobile crisis teams that can meet people at locations of their choice. Services are offered regardless of ability to pay, but the urgent care will bill insurance providers when available. Urgent care hours and more information is available at mentalhealthcrisisalliance.org or call 651-266-7900.